CMA. Today's speaker is Dr. Seema KM, consultant cornea and anterior segment, Ahalia Eye Hospital, Kannur. I invite Dr. Seema to come to the dais. The topic is eye banking and introduction. Before that, introduction of the speaker by Dr. Shweta.
Good evening. It's my privilege to introduce our speaker for today, Dr. Seema KM, who is a consultant cornea and anterior segment, Ahalia Foundation Eye Hospital, Kannur. After completing her MBBS at Calicut Medical College, DO at SRMC, Chennai, and DNB at Little Flower Hospital, Angamaly, she did her fellowship in cornea and anterior segment at Little Flower Hospital, Angamaly. Dr. Seema also did an observership in G. Sitalakshmi Memorial Ocular Surface Clinic at Shankara Nethralaya, Chennai, phaco emulsification training at Arasan Eye Hospital, Erode, and Vadwala Eye Hospital, Ahmedabad, LASIK training at New Vision Laser Center, Baroda, and lamellar corneal surgery training at Apollo Hospital, Hyderabad. She was a speaker in various state, national, and international conferences and has published various papers in state and national journals. She's a president of Ophthalmic Society of Kannur. National Eye Donation Fortnight campaign is observed from August 25th to September 8th to increase the awareness on eye donation and corneal transplantation. So on this occasion, we welcome Dr. Seema to enlighten on this topic.
Respected seniors and friends, a very good evening to all of you. At the outset, let me thank the office bearers of Kannur IMA for this opportunity. And let me also thank Dr. Shweta for that kind introduction. This is a very basic presentation on eye banking in connection with the eye donation fortnight, as already mentioned. Corneal blindness is the fourth leading cause of blindness in the world. The other causes of blindness which stands ahead of this are cataract, glaucoma, and age-related macular degeneration. Corneal blindness is a major cause of concern as 50% of the cases occur in children. It is estimated that there is 1 million corneal blind in India, and corneal transplantation is a sight-saving procedure which has the highest success rate among all organ transplants. A little bit about the history of corneal transplantation. The first successful human-to-human corneal transplant was performed by CERM in 1903, and the first eye bank in the world was established by Patton in USA in 1944. In India, the first eye bank was established in RIO Chennai in 1945. And the first eye bank in the private sector in India is the one functioning at Little Flower Hospital, Angamaly, which is called the Eye Bank Association of Kerala. Eye Bank basically is a non-profit organization. And prior to the establishment of eye banks in India, it seems that tissues used to come from Sri Lanka for transplantation in India. Promotions of an eye bank. Functions of an eye bank. It basically deals with the promotion of eye donation, registration of pledges, tissue retrieval, processing and evaluation, and tissue distribution. Every eye bank will be having few eye collection centers under the eye bank to facilitate collection from distant places. And these collection centers will be having tie-up with local organizations and hospitals and service-minded ophthalmologists in the locality. and the collected donor tissue is transported to the eye bank from the center with minimum delay. Now, what are the contraindications for eye donation? If there is a positive medical record for AIDS or syphilis, rabies, hepatitis, Ray's syndrome, rubella, viral encephalitis, slow viral diseases, also blast form of leukemia, septicemia, and if the cause of death is not definitely known, also ocular malignancies and inflammatory disorders of the eye causing gross corneal disfigurement. Refractive corneal procedures like LASIK and any anterior segment surgery and laser surgical procedures are all relative contraindications. Whether a patient who has undergone cataract surgery can donate his eye is a common question which we all encounter. So normally at birth and in childhood, we will be having a high endothelial count close to 3,500. And with age, there is a normal attrition rate in every eye. So when you undergo an anterior segment surgery, there is an added loss to the corneal endothelium. So undergoing cataract surgery is definitely not a contraindication for donating eyes. And nowadays, the collected tissue will undergo stringent evaluation. And based on the endothelial cell density in the tissue, you can use it for optical, therapeutic, or tectonic purposes. Also, death due to malignancy elsewhere in the body, snake bite, poisoning, and death due to drowning. These are all relative contraindications. Snake bite tissue is usually accepted and it fares well. Poisoning, unless it is poisoning with cyanide or heavy metals, we usually accept that. And drowning, again, depending on the time the body has been in water. If it is less than 30 minutes and if it was clean water, then generally the tissue is accepted. Again, it depends on the discretion of the medical director of the eye bank and the surgeon who has to accept the tissue. Because due to risk of infection, some people tend to avoid tissues from a drowning case. How to become an eye donor? You can sign in a pledge form and submit it in the nearest eye bank. But along with it, it is very important to discuss your wish with your family members because the donation cannot proceed unless your next of kin confirms your intentions. And also please note that recording the donation in a will not be enough because many times by the time the will is read, it is too late to donate the cornea. Usually the tissue is recovered within 6 hours of death. And even if the eyes were not pledged during lifetime, next of kin can proceed with eye donation, provided the deceased had not mentioned anything against donation during his lifetime. And if you happen to change your mind after pledging your eyes, just discard the donor card and let your family members know of your decision. Other concerns of donors' relatives. One is they generally ask, can they choose who will receive the cornea? Whether the relatives can see the person who receives the cornea? The answer is no. The recipient will always remain anonymous, unlike other organ donations. And whether the eye donation will cause disfigurement of the face? No. Hospital Cornea Retrieval Program. This was launched by the Eye Bank Association of India in 2005. Under this program, trained counselors from eye banks are stationed in multi-speciality hospitals and they keep rapport with the hospital staff. This is a form of focused awareness. And the choice of hospitals, large multi-speciality hospitals with a high mortality rate, like 3 to 4 deaths per day or more, and also medium multi-speciality hospitals with a moderate mortality rate of 1 to 2 per day. So the grief counselors come technicians, they are stationed in these hospitals and they take daily rounds. So they are aware of the critically ill patients in the ICU. They keep rapport with the relatives and the staff. They don't force the relatives, but they just counsel the relatives. So when the death occurs, if the relatives are willing, they can collect the tissue with minimum delay. They also display posters and brochures in the hospitals, distribute pledge forms, and do the follow-up on potential donors. Usually, science graduates are chosen for this training with a biology background. The advantages of HCRP are availability of the medical history and investigation reports, and time interval between death and recovery is reduced. And nowadays, number of deaths are more in hospitals than home deaths. And also accident deaths, they usually happen in hospitals. So tissues from young donors can be harvested. Eye donors can also become multiple organ donors if they wish to. So what are the instructions you give to the family members? Those who wish to donate, just switch off the fans and raise the head end with a pillow. And you can close the eyes properly, and you can place wet cotton over the eyes, which will help to keep the tissue moist. This is just a video from the Little Flower Eye Bank that the grief counselor has received a call for donation. Inform the doctor in charge over the phone. And the technician packs all the sterile instruments, sterile cotton, all these things in a bin, which is required for recovery. This is the ice box. He's taking the medium, McGarry coffee medium from the refrigerator. He's taking it in the ice box. He's also carrying the documents in which you have to record properly, donor details, cause of death, etc. Tissue recovery can be conventional enucleation or an in situ corneoscleral rim excision. This video shows conventional enucleation where the eye muscles are hooked. Resected and the globe is recovered. After resecting the optic nerve. So the enucleation is technically easier and less time consuming, but there is risk of oozing of blood, and the endothelium deteriorates rapidly when stored as whole globe. Overall utility of tissues from enucleated eyeball, it will be only around 30 to 40%. And processing after this is extremely laborious and time consuming. So nowadays we practice an in situ corneoscleral rim excision, which is technically a little more skill is required. And this combines recovery and processing at the same time because the tissue will be immediately placed in the medium. So the overall utility goes up to 40 to 50%. A gross examination is being done. Eye is cleaned initially. And then the technician is resecting the corneoscleral rim. So a skilled technician will do it very smoothly so that there won't be any folds in the tissue. When you evaluate the tissue later, you can see the skill of the technician. And a prosthetic eye is fitted, and the lids, earlier we used to suture them together. Nowadays we just glue them so that there is no disfigurement at all. And preliminary formalities also you should check, like taking the consent from the next of kin. Police clearance is required in medico-legal cases. And tissue retrieval can be carried out only after death has been declared. In brain-dead individuals, only if there is a call for organ donation, you can retrieve the cornea. Otherwise, only after death has been declared. And a gross physical examination should be done first to check for needle marks to see risk of HIV sepsis. We also take a blood sample from the donor and send it for screening for HIV, VDRL, and HBsAg. He's drawing the blood sample. And after retrieving the tissue, a certificate is provided to the family members. Also, complete donor record is very important, like date and time of preservation, name of technician, death to preservation time, and the time the body has been in refrigeration. And you can transport the donor cornea in the medium in an ice box to the eye bank at the earliest possible time. So tissue processing is performed when the eyeball is received from another hospital or when there is a request for donor sclera. This is the tissue processing lab in the eye bank and the laminar flow hood. Taking all aseptic precautions, and from the moist chamber, the recovered globe is being taken out. Clean the betadine. For making a new, he's trying to cut the corneoscleral button. The freeing the uveal tissue is being transferred into the medium. Now, when there is a requirement for sclera from the remaining eyeball, the uveal tissue is cleared and he is trying to cut out the sclera. Actually, preserved sclera is very useful for performing scleral patch grafts. When there is melt in the eye from inflammatory disorders, it is used for glaucoma valve surgeries. Sometimes in endophthalmitis, you end up with severe melt of the eye. So for tectonic purposes also, you require sclera. It's being preserved in 95% alcohol. So tissue preservation can be, as we saw, the globe in the moist chamber in MK medium, or other media used are cortisol and optisol. Whole globe is placed in the moist chamber at 2 to 8 degrees Celsius. It can be kept for 48 to 60 hours. When it is placed in the medium, if it is MK medium, the tissue is preserved for 3 to 4 days at 4 degrees centigrade. This medium is obtained from LV Prasad Eye Institute at a cost of 400 rupees per vial. Optisol is actually imported. It is 4,000 rupees per vial, and in Optisol, the tissue can be kept for 10 to 14 days. Cortisol is similar, which is produced in India by Aravind Eye Hospital. It is available at rupees 1,000 per vial. And organ culture medium is used for long-term preservation of the cornea. This table just shows the contents of the different media. So once it is placed in the medium, before using, gross examination is being done. All the donor details are recorded on the bottle also. Time of recovery, death to preservation time, all these has to be recorded in the bottle. So after that, we proceed with the tissue evaluation in the eye bank. Without evaluation, nowadays tissues will not be distributed to the surgeons. So evaluation is done by specular microscopy and slit lamp examination. So before evaluating, the tissue which was in the refrigerator should be kept outside at room temperature, not more than 1 hour. And it is better to perform both slit lamp evaluation and specular microscopy at the same sitting so that we can limit warming. And after evaluation, you replace the tissues in a quarantine area of the refrigerator until the serology is out. So this is the specular microscope. The technician is comparing the details with the donor sheet and then he places it in the well of the specular microscope. This captures the picture of the endothelium and you have to manually select at least 100 cells and then assess the endothelial, probable endothelial count in the tissue. The endothelial mosaic is visible on the screen. After that, he's selecting the cells and then trying to estimate the count. The picture on the left side shows the normal endothelial mosaic with the hexagonal cells. In this picture, you can see the variations in size and shape, polymegatism, pleomorphism. So all these you have to assess. And this table shows the attrition of the endothelial count with age. Critical cell density for the endothelial pump to function is 300 to 500 cells per millimeter square. But at such low counts, usually there will be some amount of corneal edema. A functional cell density of 1,500 to 2,200 cells per millimeter square is required to keep the cornea clear. And depending on the cell density, you grade the tissue. It is excellent quality tissue if the density is above 3,000, very good if it is 2.5 to 3, good if it is 2,000 to 2,500. And you call it fair if it is 1,500 to 2,000 and poor below that. For an optical keratoplasty, you require at least good tissue, that is at least above 2,000. If tissue endothelial count is less than that, you can use it for therapeutic keratoplasty or tectonic keratoplasty. And also nowadays we have lamellar procedures replacing the anterior layers. So there you don't require the endothelial count. So even if the count is poor, you can, and the anterior stromal layers are clear, then you can use it for anterior lamellar keratoplasty, like DALK, which we do for keratoconus. This is the tissue evaluation lab where the slit lamp examination is being performed. So first, the doctor is verifying the donor records, whether it matches with the details provided in the preserved bottle. And there is a holder in which you can place it and do a low power examination as well as high power examination and also retroillumination. So for the purpose of documenting the findings on your slit lamp examination, cornea is divided into different zones. The central 3 millimeter area is said to be the central zone. 3 to 5.5 millimeter will be the paracentral zone. 5.5 to 7.5 is the mid-peripheral, and beyond that is the peripheral zone. So this is the tissue evaluation sheet in which there are areas for documenting findings from the epithelium, stroma, decimus membrane, and the endothelium. So when you inspect the epithelium, you have to look for any signs of exposure, if the eyes were not closed properly after death, whether there is any epithelial defect, epithelial sloughing, all those have to be recorded. And when coming to the stroma, you can document about the width of the arcus, which you see in the periphery, clarity of the corneal stroma, whether the stroma is clear and compact or whether there are any scars or any infection or infiltration in the stroma, and the amount of folds, decimate membrane folds, which you can see on the tissue. All these things have to be recorded in the evaluation sheet. So in this picture here, you can see exposure inferiorly. Here there is epithelial sloughing in the inferior portion. By making a slit, you can examine the stroma for the compactness of the stroma. Decimate's folds are seen. And specular reflection again for the endothelium. So cell density less than 2000, as already said, we don't use for optical purposes, optical penetrating erythroplasty. Also, if there is extreme polymegatism or pleomorphism, presence of significant guttata, these are all contraindications for using the tissue for optical purposes. This is the grading of the tissue based on evaluation of all the layers, not only the endothelium, but based on the evaluation of the epithelium, stroma, decimates folds, and endothelium all together. And this is the final sheet which goes to the operating surgeon, which will contain the donor information, cornea evaluation details, the specular picture of the tissue, and also serology details will be entered. And there is also an adverse reaction report, which should be kept by the operating surgeon. He has to look for any infection which can be attributed to the transplantation or any communicable disease in the immediate postoperative days, which can be attributed to the transplant. Also, after trephining the required button from the corneoscleral button, the required size is trephined. The remaining rim will be sent for culture. So if you happen to find any growth on the culture, even that has to be reported back to the eye bank. So this form has to be kept for 30 days. If there is no adverse reaction report, the surgeon has to sign it and keep it in the patient's file. If there is any adverse reaction, the eye bank has to be informed. The patients in the waiting list are called according to priority. Blind in both eyes will be given preference and young individuals will be given preference. And any patient undergoing keratoplasty, it is very important to emphasize the fact that they have to come for regular follow-up for a long period, and they'll have to use medications also for a long period. Regarding the accreditation of eye banks, the Eye Bank Association of India is responsible for inspecting the eye banks, and they evaluate the compliance and proficiency of the standard operating procedures, which is being followed by the eye bank. And they also evaluate the records for the last 10 years before giving accreditation. It also reviews if the eye bank complies with all requirements of facilities, manpower, and the board of directors. Also, it evaluates whether the eye bank conforms to all laws and regulations. Legal aspects of eye donation, it is regulated by the Human Organ Transplantation Act of 1994, according to which the deceased should have registered himself or herself for eye donation. Also, close relatives and family of the deceased may give sanction in writing for removal of the cornea or eyeball. And removal of the eye tissue shall be performed only by qualified and trained professional from a registered eye bank or eye donation center. Under no condition will the tissue be bought or sold. Whatever charges are taken by the eye bank are for the processing charges, because the media is costly. Nowadays, the corneoscleral button is being retrieved. So this is an interesting ad which we happen to come across by a hospital to promote eye donation. So all of you, please donate your eyes. Thank you.
Thank you, Dr. Seema, for the excellent and very informative talk on iBanking. And the topic is open for discussion.
That is another sad part of the story. The only facility for eye collection we have currently is in the district hospital. They have a mobile ophthalmic unit. So if somebody wishes to donate, if you call the casualty of the government hospital, they come and retrieve the whole globe. And then it is transported to Calicut Medical College. Actually, Little Flower Hospital, Angamaly had set up an eye collection center in Pariyara Medical College 5-6 years back. It was functioning till 2-3 years back. There was a trained technician who was posted there in Pariyaram. And under HCRP, he used to collect tissues from Pariyaram Medical College. Outside collection was not going on. And when I was working in Malabar Eye Hospital, another collection center of the same eye bank, we had set up in Malabar also. And we had approached many multi-speciality hospitals in town, religious leaders, and we had taken classes, and one technician was also appointed. We could actually collect only 4 corneas during some 6-month period. And what used to happen in the hospitals, every time we contact the sisters and nursing superintendents, they all will tell we will cooperate. But finally, when the death occurs, they won't call us. We don't get to know. And then we inquire after that, they will tell that we forgot to call you. Same way, I had taken classes in churches because in Angamaly side, it is the Christian fathers who are supporting this program mostly. And I think it is because of the controversies related to organ donation. When we approach them, they all say yes, yes. But then when it comes to the actual donation, it doesn't happen. Nobody is willing to support. It was better if some NGO or somebody could take up the issue and set up a eye bank or at least eye collection center.
The term eye donation
Yeah.
is a misleading one. Rather than using corneal tissue transplant or corneal tissue donation, it will be more palatable to the public. Then
Means they tend to. Yeah.
It is terribly for some. You are just taking full globe.
But we don't take it in front of the relatives.
Even though that is there. So the second method, you know, it is
Yeah, for the second method.
somewhat cultured.
Yes, sir. But
Means-
for the second
Earlier
method.
was like a brutal thing you are doing and taking off.
No, but for the
from a-
second
no,
method, you
what-
require
what you
the
have mentioned.
medium.
you
Medium
have
has to be stored in some eye collection center. Only then it is possible.
What you have mentioned regarding this religious leaders and all
Yeah,
that, there'll be more peculiar regarding you are taking a. But the second method, it was very nice, just like a skin graft you are doing like that.
excising
So
the
the
button.
terminology like eye donation, other than going to corneal tissue donation, that will be more better.
Okay.
And if some ophthalmologic society in Kannur is ready, we can organize some programs to the public, especially for some persons. We have to educate the hospital management person. Then it will be very easy, and you can while taking away the dead body, you can do the procedure and can be provided. That should be promoted, and we have to request the government that the district hospital here
Yeah.
is competent to do. I think the mobile ophthalmic unit
Unit
is there
there.
also. So that also we can have a demand rather than going to the Pariyaram. We can utilize our district hospital. Thank you.
Sorry, sir.
Retrieval of the cornea
Yeah.
by a technician, is it accredited by the National Medical Commission?
In Kerala government has not approved that, but in under the Eye Bank Association of Kerala, Eye Bank Association of India, trained technician come grief counselor is allowed to do it. So most of the private eye banks are functioning in that manner now. And under HCRP, that issue doesn't come because usually death is already certified in the hospital.
എന്നാലും നമുക്ക് കാണാൻ പറ്റും.
It depends on the institute. In a tertiary care institute like Little Flower Hospital or Shankara Nethralaya or LV Prasad, there is actually a huge list waiting for tissue. They go to these places. Yeah, I have performed around 16 in Malabar. We used to bring, because even if we collect tissue here, we can't use it directly. You need to have the specular microscope and other evaluation setup. So whatever tissues we collected during that time also, it used to go back to Angamaly, get evaluated, and then depending on our position in the waiting list, we used to get it from there. They send it by KSRTC courier or something, by the bus courier or something like that. In ice box, it will come. Hospital wise, unlike organ donation, this is hospital wise. I'm not aware of all hospitals. I have worked in Little Flower. In Little Flower, we used to have a waiting list of around 30 to 35 patients. But when you call them, all of them don't come also. They will just register their names and go off. And when the tissue comes, sometimes they don't come. Like when the tissue is available, they have to come immediately. So some drop off also. Keratoplasty. For therapeutic keratoplasty, they charge around 12,000. For optical, 20,000. Lamellar procedures will be a little more costly, around 25 to 30,000.
No more questions. Vote of thanks by the Joint Secretary, Dr. Onikish.
Thank you, Dr. Seema, for accepting our invitation. This was a wonderful talk with a lot more videos. It was very clear. The message was clear, but as she said, the donations, people are not much motivated. That is actually, we have to do something from Kannur IMA for the awareness and to make more donations possible. Thank you, every member of IMA Kannur, for attending this program. Thank you.